Hello and welcome. The number of cases of coronavirus continue to rise across the country and in cities like Mumbai, which, as you know, now are the epicenters in more ways than one. The issue, however, is not that. The issue is that the mortality continues to fall even as the number of cases continue to rise, which means the doctors and physicians who are at the front lines are getting a better control of this disease as we understand it now. So the question now is, going forward, how do things look like given two situations? One is that the monsoons are setting in. We've already had a cyclone and heavy rains in Mumbai and many parts of Western India. And secondly, with the lockdown lifting and people likely to now go out and mingle, as it were, what are the conditions that could happen, and can we prepare ourselves better for that, both as public health, from a public health point of view, as well as individuals? To discuss it, I'm joined by two experts and doctors, Dr. Shrivastava, a consultant in infectious diseases, and I'm also joined by Dr. Rahul Pandit, Director, Intensive Care at Fortis Hospital. Thank you both for joining me. Dr. Pandit, let me begin with you. So how are you seeing the progression and severity of the COVID cases that you've broadly encountered in the last 4 weeks and more so in the last week or so?
Thank you very much, Govind, for having us on this show. Look, I think we are in the thick of it. That's how I would like to put it. Okay, I don't want to say whether we are at the peak or we are at the receding end of the peak. I don't know that. Nobody knows that probably. But we are in the thick of it. The number of cases which we are seeing, what we medically call as SARI, which is severe acute respiratory infection, which then probably goes and translates into a COVID positive or a COVID negative, whatever it could come with the swab, are certainly coming to our intensive care units, and the intensive care units are getting patients every single day with SARI. Fortunately, as you rightly pointed out, we have been able to offer them therapy in terms of intensive care support, and the mortality remains at around 3.2, 3.3 for Maharashtra and Mumbai, around about at that mark, which, if you consider it and compare it with the world average, it is better. Okay. However, we are seeing a number of patients who are now requiring ventilators as well, and we are seeing a number of patients who are requiring high flow oxygen therapies. Okay, so there are different ways through which we give oxygen. Some of them are given. Some of the mechanisms to giving oxygen is through a machine, what we call as HFNC. So infrastructure built up, infrastructure stretching is happening. We have been able to cope up with the cases right now. And I think that's a lot to do with the lockdown as well, that we've had a steady flow of cases coming up until now.
Right. So are you saying that the number of cases going into intensive care has increased in the last, let's say, 2 weeks as opposed to the previous 2 weeks or 4 weeks?
Yes, definitely. The number of cases, number of requests I'm getting for intensive care have definitely gone up in the last couple of weeks. However, as I said, the infrastructure has also expanded. So more private hospitals, more public hospitals, field hospitals have come up. And I think fortunately, we are able to now cope up with the whole situation.
And why would you think this is happening? I mean, why is it happening now as opposed to earlier? I mean, apart from all the logical reasons, because we have been in lockdown now for almost 70 days. And it would at least logically mean that the transmission has slowed down, and people have gone through many cycles of not having the disease.
I think the country as a whole and Mumbai as a city, we are following the pattern what is seen in the world, where we are now on a rise up and probably in the thick of things. As I said, I don't want to comment where we are in the terms of graph,
sure,
but we are certainly getting several cases now as opposed to what we were getting, say, 5 weeks ago, 4 weeks ago.
And amongst these cases, are you seeing any other patterns in terms of either the age profile or the comorbidities or the kind of comorbidities?
So obviously, we all know now from the last 5 months, 5.5 months, that the virus has been around in the world, that diabetes, hypertension, age above 60, these are some of the comorbidities. Patients who have had cancer or who are on chemotherapy, whose immunity is low. These are some of the patients who have a high probability of catching the virus, and their immune system being blunted, they are not able to fight off the infection that well as well. So obviously, those are the ones which we are concerned of. And India being the almost like a diabetes capital of the world as well. I don't want to label it that way, but we have a lot of diabetes patients as compared to the Western population. We are seeing a number of patients who have diabetes who come to us.
What would you say is the highest percentage or proportion of patients or the proportion of comorbidities in the serious cases that you're getting?
I have not calculated that, but most of the serious cases would have some morbidity. Obesity is coming up as another morbidity as well, which has not been very well described in the Western population. But in the last 2 or 3 months, it's been talked a lot about.
Right. Yeah, and obesity is something that I've heard from other hospitals as well. Dr. Shrivastava, let me come to you. So we have we are in a couple of situations here now. One is that the lockdown is lifting, and it has lifted in other parts of the country, and in Mumbai, which is in some ways amongst the last cities to go in, it is going to start easing up, and people will start meeting with each other and mingling as we speak. And at the same time, we've had the arrival of the monsoons with a thunderous cyclone, as it were. So, how do you, as an infectious disease specialist, see this situation, and what could become, or what could we see going ahead?
So, thank you. First up, you have 3 questions. You've asked me 3 questions. Thankfully, the cyclone was limited to a few hours, and not it didn't create that kind of havoc that is normally expected with this kind of events. Normally what happens is that after so much of waterlogging and disruption of normal life, what happens is that there is an outbreak of waterborne diseases, mostly waterborne diseases, but other diseases as well. So hopefully, with the kind of impact that it had, not just in Mumbai but most of coastal Maharashtra, that damage should be minimal. I mean, you still need to prepare for it, but I don't think it's going to be a very, very humongous kind of a number to start dealing with outbreaks of newer diseases. The second part is with the monsoon. Yes, I think it's pretty logical that you will probably need to look at the kind of burden that public hospitals or private hospitals have had in the last 2 or 3 years, and project about what is the resource that you're going to need to prepare for the monsoon of 2020. Because that division of resources you will need to put also, so that the number of people who are being used to treat COVID should not have the same kind of interaction, because the healthcare worker who's looking after a COVID patient may not necessarily be adept or be able to look after somebody with a dengue or a chikungunya or a malaria. So you'll need to have that division as well. And so yes, I think it's going to be a projection of numbers and figures which don't always tell you the entire story. But you will need to, from between now and the end of September, you'll need to prepare for all these situations so that you are able to deliver the kind of service that is required, right, both for COVID and non-COVID infections.
Right, and let me ask you about COVID for a moment. I mean, in your study of it or your interaction with patients, what's your sense? I mean, how is it spreading, and is it following the logical course that any viral disease follows? Are you seeing any trends that are different, maybe from other infectious diseases that you've dealt with? And essentially, what are your experiences?
So I think it's a little brave and premature to comment as to how this virus is behaving or how it's going to behave, because it's a brand new virus. We've known it for all of about 5 and a bit of months, right? Less than 6 months. It's a small virus. It's already shown that there are some mutations, internationally, globally, we know about that. It is a little difficult to say exactly how it's going to behave. So far as patterns up until now are concerned, it is following a fairly classical pattern that it has had in, say Italy or the United Kingdom or parts of the United States. Different countries have had different strategies to deal with this phase of the disease. So I don't think we should be comparing, because none of the things that we are doing are going to be identical to every other country or any other country. So as up until now, I think with the kind of resources that are available, Mumbai and the BMC have done a good job. But it remains to be seen as to how long this phase of these numbers last. Is it going to be escalating? Is it going to be dwindling from here? We don't know. We'll probably know once these numbers start to fall, that yes, we are probably coming to, as the people who do the models say, that end of the curve, or the curve is flattening. But up until then, no, it's only conjecture, it's only projection, and it's probably a lot of hope and estimation that this is what will happen. As to what actually happens, we'll have to wait and see.
Right. So you did say that this follows the pattern of most such viral diseases. Now, my question is that, as we get out of lockdown and we start mingling and moving around, and at some point public transport will begin as well, how do you see the spread? For instance, there was I won't say it was definitely not a fact, but there was hope that a summer would, slow it down. But that may not have happened or doesn't look like it's happened. And there are rains coming now. So the environment is definitely changing, but the disease continues to spread and move almost with the same pace and intensity as it did earlier. Or are you sensing anything different?
So see, the biggest lessons that have come out of the last 70 days is that there is a role for social distancing, and there is a role for ensuring that you are not spreading the virus by contact to another person. That means you need to be making sure that your hands are sanitized. Any surface that you touch is clean as well. If we have not learned the lessons in the last 70 days and we do not continue with the same kind of discipline, then I think that we should be preparing for this kind of thing, not just staying in our lives, but probably having a far more grievous impact. So I think that there is a role to talk to, the common man, the common person, and everybody else. I think everybody else is a stakeholder here, and the responsibility of social health, not just your health, but of a community, it cannot be only on one set of people. It has to be starting from the individual. So I think that if we are not able to keep the social distancing, then we probably will have to learn the same lessons in different ways. I'm hoping that when the lockdown gets lifted, we are going to have that amount of discipline that we had in the last 8 weeks or 9 weeks, and that we should be able to keep this kind of a virus under control, and probably allow over a period of time this virus to become like a community infection, rather than having the kind of impact it has right now in our lives.
Right. Dr. Pandit, what's your sense, and what have you been seeing in non-COVID cases? Some of the other doctors that I've spoken to, for instance, feel that the number of non-COVID cases have come down. I'm talking about severe non-COVID cases, and have come down because there has been a certain discipline that has been self-imposed in the last 60, 70 days. Is that your reading as well? Or if not, what are you seeing?
So the hospital where I work is a hybrid hospital. Hybrid means we look after, there's a section dedicated to COVID patients and there's a section dedicated to non-COVID patients. Now, what I'm seeing is, yes, there are certain category of non-COVID patients which have come down. I can enumerate them very easily.
Sure,
for example,
please.
Routine surgeries have gone down. Okay, so there are no heart surgeries or non-essential surgeries happening. Only emergency surgeries are happening right now. Secondly, touch wood, and with the traffic and the lockdown being low, the road traffic accidents, the train fatalities, and all those things have gone down. So we know that. But the heart disease is still there. Strokes are still there. Infections apart from COVID are still happening. People still have gallbladders and urinary bladders which are getting infected, and they are coming to the hospital with infections. We are actually looking at those patients quite regularly now in our hospital. I don't think I can say for sure that the patients have dropped down, because if the lockdown lifts up, and as Dr. Shrivastava said, if you don't follow the social distancing norms, you would have a rise up in these cases again, like road fatalities and stuff, which are very unfortunate. But the routine surgeries, I think, will take some time to pick up. People will need to have a lot of confidence. And when I say people, hospitals, doctors, as well as patients will need to have a lot of confidence to go in for a non-essential surgery right now. So I think that's going to take some time.
Right. You mentioned obesity and diabetes. Now, can you tell us a little more about, this is also obviously trying to see if people who already have some element of obesity or suffering from it or diabetes can be better prepared. So what are you seeing, and could those patients in some way be more careful compared to the others?
I think anybody who's had a COVID has social discipline, social distancing, mask up India movement needs to be basically coming up where everybody wears a mask. If there are two people in the room and one of them is infected, but if both of them are wearing a mask, there are these statistical models which say that the chance of that person transmitting infection to the other person in the room come down to single digits, perhaps even 1 or 2% or less than that. Okay. Now, I think these are the things which all of these people who have comorbidities need to follow up very, very strictly and bring that as a part of their new normal life. This is the new normal life which all of us have to go forward with, and more so for people who have these comorbidities which are at risk of having a poor outcome if they contract a COVID-19 disease. That's all. That's the only message I can say. I mean, they have to be careful. No question about that. Keep up on top of their sugar levels. Keep up on top of their blood pressure. And, it is in general, if you have a controlled disease, if the disease is controlled, so subversive has been fairly controlled in his disease process, so absolutely be any different than a person who does not have the disease. It's going to be slightly higher, perhaps, as opposed to somebody who's got an uncontrolled comorbidity.
Right. Okay. Dr. Shrivastava, so as someone who is here, I mean, here as in the city of Mumbai and bracing for monsoon and post-monsoon impact, how are you feeling in terms of the combined pressure of COVID plus non-COVID, which could come in? I mean, are we ready for it, and how could we be more ready if that's a possibility?
I think we are as ready can be. I think the structure of this kind of thing is you see what is the volume that is going to be placed onto either a public hospital system or the private hospital system, and you accommodate accordingly. What is the best way you can divide your resources. You've got only a finite number of people who are working at this time. You'll have to find out what is the best way that you can utilize those resources. So yeah, I think that in the structure of the illnesses that are already amongst us, like COVID, and what might be in the next 2 or 3 months, the people who have planned would have planned, I'm sure, for all these things to be factored in. So yes, I would have to say that, look, it should be manageable. But like I said a little while earlier as well, we will know only when the moment arrives upon us. As of now, it's only a plan and a conjuncture. For all you know, that the burden of monsoon-related illnesses may be lesser than last year. It may not have the same kind of impact that it had last year. In which case, the resources that are available may be better utilized for COVID care, if indeed COVID care continues to be in the same numbers as it is right now. So it is preparation, the best that you can do with the resources that you have, and then adapting. If you're not able to meet that requirement, then you have to make an adapting strategy that becomes different.
Many doctors, and I guess the data is also reflecting that, are saying that we now have a better grip. I mean, we obviously have not found a cure, and a vaccine is also far away, but we seem to have a better grip on this disease today than we had perhaps even 6 weeks ago. Now, how are you? Are you feeling the same way? Are you confident that we are in maybe better control than maybe some doctors have or hospitals have been in other countries? And I'm only comparing with other countries here. And therefore, do you think we are, or rather, how do you think we are positioned in the next month or two if this were to get even wider than what it is?
I wouldn't say that we've got a grip on the whole process as yet. Definitely, we know more than what we knew in January of this year. Yes, we know far more than that. We didn't know a lot of things as to what might be the process of the pathology and the complications, and what is it that we should do to preempt those things and probably make a better strategy so that those patients who may have suffered before this data came about, the next lot of patients may not have to pay the same price. So yes, we are definitely far, far better than what we knew when things started in January. I don't think that we know all about it, and we are learning just about every day. Every day there is some literature. There is a flood of literature that comes out of some very learned people, and that based on their observations, we are also adapting. I don't think you can translate anything that has happened in another country as a model that we should replicate. But there is something to be learned from everybody who has some scientific evidence that will stand scrutiny. It has to stand scientific scrutiny. There are a number of things that are that are tossed around as to a small set of people have got evidence on a small number of patients, but that does not make it something that will become mainstream treatment. So when you are looking at what will be the best, practice of medicine, of course you are going to need to learn every day, but you'll need to know what is going to be in the best interest of the patient who is coming and seeking treatment from you. Vaccine is at least a year away. Vaccine is, the one thing about vaccines is that when you're trying to compress a process that would have taken maybe 3 or 4 or 5 years, when you try to compress it into 9 months or 10 months, you are probably going to make a hurried assessment of something that probably requires far more effort. So I'm not in favor of running into a vaccine right now. I'd much rather wait and see that it has gone through all the processes that a vaccine needs, because the last thing you need is somebody who has had a fatal reaction to a vaccine that was made in a hurry, and then you have done more harm than good towards the vaccine or something like this. So I think that the vaccine should be a little time away. It should go through the entire process of being as adept as it can be in a situation like this, and only then it should be introduced into a general population.
We've run out of time. Thank you so much, Dr. Pandit and Dr. Shrivastava, for joining me. I wish you and your teams and colleagues all the best in this fight against coronavirus and the post-lockdown era, which promises to be tough in the middle of monsoons. Thank you so much.
Thank you,
Govind. Thank you. Take care.